Hi, my name is Dr. Jim, and today what I'm going to be talking about is nursemaid's elbow, or what's known as radial head subluxation. So nursemaid's elbow, this is when the radial head pops out or slips out of its circular annular ligament that holds it in the elbow joint. Now this often occurs in children ages 1 through 4 due to their less developed bone. The elbow joint is composed of 3 bones, the humerus, the radius, and the ulna. Now the radial head is connected to the elbow joint by the annular ligament, which you can see on the picture on the right here. So this next picture, what I'm trying to show is the differences in size of the radial head of a child's arm compared to an adult's arm. Now you can see the size differences, and you can see why this occurs much more commonly in children than in adults. So what causes this? Well, a lot of times when children learn to walk and they want to go places where they want to go, right? So a lot of times parents or an older sibling are tugging, pulling their arm. This is the most common occurrence, when we're tugging at their arm and it pops out of place. Now, the second thing that can occur is if you're swinging them. They're swinging them by their arms. That can cause the radial head to pop out of the ligament as well. And the less common occurrence is when they fall and they're falling on the outstretched arm. That can cause it to pop out, but not as common. So what are the signs and symptoms of a child that has nursemaid's elbow? Well, first, they're not going to really want to use that arm, so they're going to favor it a lot. Secondly, what they can do is they'll hold it in place, have it slightly bent, and the hand's going to face their stomach, like how I'm doing it right here. So that's the most common symptoms and signs of nursemaid's elbow. So what do you do when your child has this nursemaid's elbow? Number one is contact your provider, contact your clinician, whether it's an MD, chiropractor, DO, or a clinician that knows what they're doing, knows how to pop it right back into place. Secondly, sometimes if the child is playing using the affected arm, they can sometimes pop it back into place. So I'm going to show you guys how it's done. And again, I really want to stress, don't try this at home. Again, contact your clinician, contact your MD, chiropractor, DO, somebody that knows what they're doing again. So what we do is we straighten the arm, the affected arm that is, we straighten it and then we flex it back towards the bicep. And then at the same time, we're also rotating the forearm outwards. And usually you can hear a click, and that's when you know that it's popped back into place. Now this, you may have to try a couple times before you get it in too. So if the first time it doesn't work, just go ahead and try it again. Thank you for watching. If you like the content and if you enjoyed the information that I've given you here, please like, subscribe, and share my channel. I appreciate it. And until I see you guys again, take care.